sternal notch, okay? So you just got to feel for the hump in the sternum. And you got to tell me where this is the sternal notch and this is where it is. And then you've got to say this is where the costal angle is. The costal angle, what does coast mean? Ribs. Okay, so we all know her ribs are right here. It's over her thoracic cavity. So the costal angle starts from the breast and it goes down. It makes a triangle. And it's what pretty much makes up your thoracic cavity. And so it is going to be right here. It's going to be the triangle right there. That's called your costal angle. And then you got your midclavicular line, and y'all should all know where that is. Where's that? Find your clavicle. You divide it in half, and the midclavicular line is going to be in the middle of both of the clavicles. What about the mid-axillary line? Yeah. So you're actually going to have to say this is the mid-axillary line, which is in the armpit, and divide it in two. And then you got your scapular line, which the scapula is right here. It's your shoulder blade. And the scapular line is right here on both sides of the scapula. And then you have got your C7T1 prominence. So can you put your chin to your chest, please? See that hump in her where her spine is? And we can all feel ourselves. See, put your chin to your chest. Feel your hump. That's your C7T1 prominence. That's where your
Wait, which one is it?
The top one or the bottom?
Yeah, there's two big ones.
I only got one big one. There's two.
There's two.
The first one? Oh, there's three.
There's
Go
three.
higher. Go
There's three. No, just where it comes out the most. That is your C7T1 prominence.
I would say this
And that, where do you think, what is that? What does that mean?
the seventh cervical something.
Seventh cervical vertebrae and your first thoracic vertebrae. So that's where they meet. Okay?
Mine hurts.
And then your costal vertebral angle. What's your costal vertebral angle, you think?
Something, rib, vertebrae.
It's the back. So it's going to be the triangle in the back. So it's going to be where your ribs make the triangle on your posterior side. Okay, whenever you do your exam, you're going to have to listen to anterior lungs and posterior lungs. And there's certain things you're going to do on anterior side, and then there's certain things you're going to do on posterior side. So I'm going to start off by inspecting. Because y'all remember the order of assessment? How do you do it? What comes first? Inspection. Okay, the abdominal exam is a little bit different than all the other exams. So you inspect first, you palpate second, you percuss, and then you auscultate. Okay, inspecting is looking. Do y'all remember what palpation means? You feel. What's percussing? It's whenever you're feeling the vibrations and seeing the sounds as you hit on something. And then what is auscultation?
Listen.
When you listen with your stethoscope. Okay? So I'm going to start off by inspecting, and I have on there everything that you're going to be inspecting for. Skin color, thoracic configuration, and that's just looking at, the equalness of it. Does she have a big hump right here? Or does she have a deformity, like is one shoulder lower than the others? I mean, that's what configuration means. And then use of accessory muscles. What does that mean? What does accessory muscles mean?
It's ones that you voluntarily.
Okay, and if you are using accessory muscles as you breathe, that's not good. That means that you're struggling to breathe. So an accessory muscle is going to be whenever they breathe, it needs to be kind of slow. It needs to be easy. And if their nostrils are flaring out, that's considered an accessory muscle. If you can see they're in between the ribs, if you can see that area, that intercostal area pulling, that's an accessory muscle. If they're using more muscles than they need to breathe, then that means that they're using accessory muscles. Okay, like say for instance, whenever White got really, really sick last year and got put in Children's Hospital, he used accessory muscles. Whenever he breathed, his intercostal space is sunk in, and that's called a retraction. And then he was breathing with his stomach a lot because he was trying to push that air with his stomach out because he couldn't breathe any other way. His nostrils were flaring because he was trying to pull and push as much air as he could in and out. So that's what that means with accessory muscles, using extra things to breathe. And then what do y'all think? I just told you, what's the intercostal retraction? I just told y'all. When the intercostal space sinks in, when they're trying to breathe. And then symmetrical movement. What is that?
Is that up here? When this sinks in?
It's the space is in between your ribs.
Okay.
The intercostal space is the space in between your ribs. And whenever you see a retraction, they're breathing and it's sinking in. because they can't breathe and they're trying to get more air to move around. And then asymmetrical movement or asymmetry of movement, what does that mean? It needs to be equal on both sides. So when you're looking, that's what you're looking for. All that's inspecting. Skin color. What am I looking for with skin color?
Discoloration.
Would the respiratory system know what am I looking for? I'm not doing a skin assessment like with the abdominal system to see just, if there any just weird stuff. I'm looking at cyanosis. What's cyanosis? Blue skin. What does that mean?
Means they're not getting the circulation.
Meaning they're not getting enough oxygen. What's the technical term for not enough oxygen? Hypoxia. So you're looking for cyanosis, and where am I looking for cyanosis?
On
The lip.
the extremities.
Looking at her fingertips. Okay. I'm gonna see if her fingertips are blue. I'm looking around her lips. I'm seeing if they're blue. I'm looking overall is her skin blue, but specifically lips and fingertips because they're the first things that become blue. What about pallor? What does that mean? Pallor is like extreme paleness. That could be a result of something going on with the respiratory system. So you're looking at stuff like that, okay? And then just don't be so freaked out whenever you're having to go through all this and say it to me. Okay, my advice to you is I went over what all this is. Okay, you don't have to tell me what thoracic configuration is. You just have to tell me that I'm looking for it. I want you to know what it is though because it might be on your test. Does that make sense? But my advice to you when you're practicing these assessments is do it in the mirror and look at yourself and talk to yourself. Be like, okay, I look for skin color, I look for thoracic configuration, use of accessory muscles, retraction, symmetry. I mean, just, you're repeating it to yourself. And then you're going to learn it as you repeat. Okay, now, this is where it's going to get a little bit more difficult. Now I have to assess the respiratory rate. What is respiratory rate? What's normal? 12 to 20. 12 to 20 breaths per minute. Okay, so now I've got to look at them, and I've got to watch their chest rise, and I have to count how many times a minute they're breathing. Okay, and so I need to do this for 1 full minute. If you're really good at it, 1 full minute. If you're not so good at it, do it 30 seconds, and then multiply that result by 2. Okay, so, if you're not good at it, you do it for 1 full minute. Like did I say that?
Yeah.
Okay, I just got excited. I was like, what did I just say? If you are good at it, then you can shorten it and do it for 30 seconds and multiply it by 2, just to save some time. But what if her respirations were abnormal and like she's not breathing?
You have to do it for 1 full
You have to do it for 1 full
minute.
minute to get an accurate result. Okay, so you're gonna do that. So you're gonna remember how to have your watch, and you're gonna have to count every time her chest rises and falls. I'll tell you a trick. Because it's hard to learn respirations. You look right here at her clavicle, and you can see it move. Oh my gosh.
Trying to see with that bird.
Okay, you can look at her clavicle, and you can see it move as she's breathing. Do you see it moving?
Yeah.
Okay, that's a trick. Okay, also with a man, you can look at their stomach, because men are mostly stomach breathers. You're not a stomach breather. But men are mostly stomach breathers, so you can watch their stomach. Because a lot of times if you're looking at their shirts, you can't really see. So you got to look at skin in order to really, really see. So you're going to do that next after you inspect. Then you're going to do that for 1 full minute or 30 seconds.
Someone go to the office.
Okay, so not me.
Yeah, not you.
Okay, now I'm going to palpate for what we call vocal fremitus. Okay, do y'all know what that is? No. Okay, that is what we're trying to say. Whenever they talk, we're supposed to feel their vibrations. Okay, so this is where you're going to have to I'm going to have to get on this side. Okay, and whenever you see that, I want y'all to understand what all this says. Whenever you're palpating for vocal fremitus, it says that the patient has to say aloud blue moon or 111 or 99 while you palpate the ulnar surface of your hands. So that means I'm going to move her hair. I'm going to put my ulnar surface of my hand on her posterior chest. What does posterior mean? Back. Okay, and then I'm going to tell her, can you say 99?
99.
Say it again.
99. 99. 99.
Okay. I want y'all to come here, Haiti, and just see what I'm feeling for, okay? Because it's really cool. You're supposed to feel a little bit of vibrations. That's normal. Now say it.
Letter. Hold on. 99.
You feel it?
99.
You feel that vibration? That's normal. So you're going to state, I have on there exactly what you need to state. Normal findings would be, it would be relatively easy to feel vibratory sensations. Okay, you don't want, if you don't feel something, that's not normal. But if you feel like too much vibration, then that's not normal either. You want to feel just, do you feel it? Y'all feel it?
Yeah.
99, blue moon. Blue moon.
Y'all are practicing it. Okay, you want to feel the vibrations. And that is called vocal fremitus. You got to know these terms. Vocal fremitus. And number 5, now I'm going to palpate for respiratory excursions. And you've got to tell me, okay, I'm palpating for vocal fremitus. Now I'm palpating for respiratory excursions. Okay, with that, it says that you are going to place your hand at about the 10th rib. There's a lot of gibberish in here, okay? You're going to learn a bunch of fluff in these questions, okay? Okay, it says level of the 10th rib bilaterally. What does bilaterally mean? On both sides. Okay, so just remember that, and their thumb is going to be along the side of your spine. So pretty much, if y'all can y'all come on this side so everybody can see? You want to turn and face that way so everybody can see? Okay, about the 10th rib is going to be about right here, okay? Right here at the costovertebral angle. Thumbs are going to be about like this. Okay, and now I'm going to say, can you take a deep breath and exhale? Do you see how my thumbs moved up together and they moved down together? Okay, do it one more time. A deep inhalation. See? Now exhale. It goes up together and it goes down. And this is how you accurately detect symmetry with our breathing. Because say she took a deep breath and this one moved up more, but this thumb stayed the same. That would mean that there is something going on with one of her lungs. So this is accurate. I hate that y'all are recording that. Gosh. Okay, next, do y'all have any questions about respiratory excursions? Okay, it detects what? Symmetry, okay? Number 6 is percussion. Again, it says we're going to percuss the posterior lung. And you do it in a sequence, okay? Same way we do for the abdominal exam. Normal sound on the lungs are called resonance. Resonance. And that is just a equal sound. Everything's the same. It's not too loud. It's not too soft. It's, timpani. Remember what timpani sounded like? It sounded like a drum. This sounds like, because the lungs is a solid organ. So this is resonance is what you're going to always hear over a solid organ. Resonance, RESONENCE. Now I'm going to auscultate. Okay, when you auscultate, you got to go in a systemic pattern, which means, okay, I percussed in a systemic pattern. Okay, now auscultate. Do the same pattern. Okay. Take a deep breath. Okay. And one more. One more. And one more. Okay, that's how you auscultate. It's pretty easy, and you've got to tell me the normal breath sounds. Vesicular is what you're going to hear over most of the lungs, okay? And then bronchovesicular is heard over both of the main bronchi, which is going to be on the anterior side. So that's where I'm going to have to walk around. Hold on, make sure. So vesicular is heard over most of the lungs, and then bronchovesicular is going to heard anteriorly on both sides where the main bronchi is. And it's going to be more pronounced on the right side. Why do you think it'd be more pronounced on the right side?
Because the right side has three lobes instead.
Right side has 3 lobes because and so that bronchi or that bronchus is going to be bigger. Okay. Okay. Take a deep breath. Okay. And take a deep breath. Okay. You're wheezing on that side. You said you had asthma, don't you?
Yes.
Okay, and now we're going to listen. Okay, this was bronchovesicular. This one is vesicular. And then it says the next one is called bronchial. And this is going to be right here, kind of just in the center, to the top of where our sternum is. So remember, bronchovesicular, bronchial, and then vesicular is going to be over most of our lungs. Does that make sense to y'all? And there's not much difference with these sounds, okay? So I don't want y'all to think when y'all are listening on your own that you're going to hear these big elaborate changes. They're really not, okay? They sound almost the same. It's just a little bit different. Like this one is more of a lower pitched than any of these. And you're going to hear the bronchial or the bronchovesicular bronchial sounds. No, I mean vesicular sounds over most of the lungs.
That his brother will be here to pick him up out in the front when the bell rings.
Okay. So next thing is you got to tell me about the adventitious sounds. Okay, now you tell me I would hear vesicular over most of the lungs, bronchovesicular over both of the main bronchi on the anterior side, more pronounced on the right, and then I'd hear bronchial sounds over the top of the sternum, over close to the trachea. So now, adventitious sounds is wheezes. If I heard wheezes, they're at high-pitched, musical quality, kind of, where air is a narrowed airway and air's trying to push its way through. Rhonchi is low-pitched snoring quality, and then crackles or rails are fluid in the lungs, and then they sound like a popping sound, and they're very inconsistent. Like you'll hear one, and then you might not hear another one. Y'all have any questions about all that? Okay, now last part. We are going to do bronchophony, whispered pectorilloquy, and egophony. This is not hard right here, okay? Okay, this is hearing voices as you are listening, as you're auscultating. So again, you're going to go posterior side. And I like the word 99. It says you can say blue moon, 111, or 99, and you're going to listen. And they don't need to scream this. They just need to say this normally. Okay, can you say 99?
99.
Okay. Alright, this for bronchophony, should be soft. It shouldn't really be muffled. You should be able to hear what they're saying pretty much. Okay. It should be audible. If it's not, they could have something going on like lung cancer, or they could have a pneumothorax, and there's all kinds of stuff that could be going wrong in their lungs if you could not hear it. Okay, now whispered pectorilloquy. Can you whisper 99? All right. You can do it a little bit louder than that. Okay. Are you doing it? Okay, because I can't hear it at all. With a whispered pectorality, it should be faint and muffled and almost inaudible, but you should be able to hear something. Do it one more time. Whisper.
Okay, hold on. I'm laughing.
That's better. I couldn't tell what she was saying, but I could hear something. Okay, you want to be able to hear it a little bit, but you're not gonna be able to understand what they say. And then the last one is egophony. Okay, this one's kind of funny. Y'all gonna have fun with this one. Okay, you're gonna be auscultating, and they're gonna say like screech e. We'll say e e e e. Okay, it needs to sound the way you know that this is normal is if it sounds like e and not ah. If it sounds like they're saying ah, but they're really saying e, that means that they have got some sort of a mass. They have got maybe pneumonia. They could have like a major lung infection. They've got some sort of congestion in there that's causing you to not be able to hear properly. Okay. So again, say E. Okay. It sounds like E. Okay, and then that would conclude your respiratory assessment.
Yee.
Thank you for tuning in.